Good evening, ladies and gentlemen. Welcome to my show, Lifestyle with Dr. Moby. I'm Dr. Moby. Today we're gonna talk a great deal about very important concept, and that is about falls in elderly. I don't know if you're a practicing physician or caregiver, but it is one of the most common thing which anybody will actually encounter. So when we see those falls, then a whole set of things start to intrigue us and see what really brought that on. And in my opinion, that is called emergency for any geriatric providers or any providers. So for that in mind, let's talk today a great geriatrician, and he's gonna educate us a little bit about falls. Welcome, Dr. Ahmed.
Thank you.
Tell us about yourself and a little bit practice.
Um, I'm internist
Mm-hmm.
and also practicing geriatrics.
Mm-hmm.
We live in part of the country where a lot of geriatric people, one of the highest concentration,
Mm-hmm.
and probably highest is probably Florida.
Okay, yeah.
So,
Mm-hmm.
so we have to deal with geriatric population a lot, and you face a lot of problems that otherwise you will not see in any other group.
Mm-hmm.
One of the issue that you always feel that
Mm-hmm.
they suffer is fall.
Mm-hmm.
Every time I see the people, I say, "Hey, don't fall,
Mm-hmm.
because it's going to change your life completely."
Mm-hmm.
And in spite of that,
Mhm.
there'll be a lot of falls,
Mhm.
and 30% of all the falls
Mhm.
happens over age 65.
Mm-hmm.
So as you add dementia to that,
Mm-hmm.
it risk is doubles, almost
Oh.
60%.
Mm-hmm.
So it is a major problem in geriatrics, and we feel that it is a dreadful situation.
Mm-hmm.
The prognosis is pretty dismal when this happens to geriatric patients.
Mm-hmm.
So, what do you have any questions specific?
Yeah. So let's kind of focus a little bit on. So there are certain settings. So one is, they could be in the hospital,
Mhm.
and second is they could be in a nursing home. A third is assisted living, or it could be home, right?
Yes.
So those are different situations. Do you think all differ what you normally see where people fall most?
Most at home, because most of the people live at home,
Mm-hmm.
and these are accidental fall,
Mm-hmm.
and that there is maybe some risk factors that they should have taken care of before they fell, because we get older slowly, and
Mm-hmm.
we don't think that the thing that I have done 5 years ago I will not be able to do now, because we get older one day at a time,
Yeah.
and so we don't think those things.
Mm-hmm.
And 70% of the falls are
Mhm.
accidental falls,
Mhm.
and if you fall and break your hip,
Mhm.
that is a disaster.
Mhm.
And most of the people who fall and break their hip is over 75.
Wow.
So if you fall
Mhm.
and you will either have broken hip or you can die
Oh.
from the trauma
Oh
itself.
my.
So there is approximately 10,000 deaths per year
Wow.
from fall.
Wow.
So there's a lot of people dying,
Mhm.
and something you could do about it if you knew what to do.
Okay.
And so, what causes the fall?
Mhm.
Suppose you're older and has a pneumonia, and your balance is not that great, then you get some sort of infection.
Mhm.
So you get pneumonia,
Mhm.
urinary tract infection, and some people have the COPD.
Mhm.
They can breathe well. Those people tend to fall more.
Okay.
One way to avoid this, we always emphasize having a vaccination for pneumonia.
Mhm.
There's two different kind of vaccination, was Pneumovax
Mhm.
and Prevnar 13.
Mhm.
Both works great in combination.
Mhm.
Prevnar 13 has a higher efficacy than the Prevnar 13, but both works. But first you have to give Prevnar 13 if you have never had pneumonia vaccine.
Mhm.
That is also might help you not to have a broken hip in future.
Mhm.
So what happens if you have a broken hip?
Mhm.
25% of the broken hip people will be die will die in 6 months.
Wow.
So it is a not only dying, falling and hitting your head, even if you have an operation, surgery, hip is fixed, 25% people will die.
Yeah, that's a big number.
Yes, it's a very big number. And so we have to do everything possible
Mm-hmm.
and before
Mm-hmm.
somebody falls.
Mm-hmm.
So what are the risk factors?
Mm-hmm.
Age obviously is a risk factor because our balance gets off slowly, our eyes are not as great.
Mm-hmm.
You don't hear, your sensory neuropathy from diabetes, so you don't feel as good as.
Mm-hmm.
So from some reason,
Mm-hmm.
white people has a more broken hip than black
Mm-hmm.
or African American.
Okay.
Maybe they have a better bone to start with,
Mm-hmm.
or body mass is better.
Mm-hmm.
And we know that
Mm-hmm.
African American has a better body mass.
Mm-hmm.
And people who live alone
Mm-hmm.
tends to fall more.
Oh.
And people who use a cane or a walker,
Mm-hmm.
they also falls more.
Okay. So they.
One thing that we always ignore is about the medication.
Okay.
That has a big role how many people or when people will fall.
Mm-hmm.
There is a government or a list of medication that Medicare tells, they're called Beers list.
Mm-hmm.
A lot of medication are not safe for geriatrics.
Mm-hmm.
So those medication needs to be taken off the list if possible.
Mm-hmm.
Just to give an example,
Mm-hmm.
for diabetic, you don't want to have them hypoglycemia.
Mm-hmm.
So their sugar needs to be controlled to the point of control, but not too low,
Mm-hmm.
because that is dangerous from them.
Mm-hmm.
And another is the blood pressure medicine.
Mm-hmm.
And the new blood pressure guidelines say that you can have a little bit higher blood pressure for older people.
Mm-hmm. Yeah.
And I think that is safer because low blood pressure will cause hypotension and fall. And falls means disaster.
Mm-hmm.
And then another is an anti-anxiety medicine,
Mm-hmm.
like a barbiturates, acid, and anxiolytics. Those has high incidence of fall and
Mm-hmm.
fractures.
Okay.
We try to avoid anti-anxiolytic in older people as much possible.
Mm-hmm.
There is a medicine grouped as a tricyclics, which is an antidepressant.
Mm-hmm.
People should not be taking tricyclics or any anticholinergic medication, but some depression medicine is okay, like a SSRI that you can.
Mm-hmm.
Some generic name is citalopram,
Mm-hmm.
which is a good medication, and it is okay. And what happens? Some of the medication can cause vertigo
Mm-hmm.
and fall
Mm-hmm.
and visual disorder
Mm-hmm.
and blood pressure low.
Wow.
People have joint pain, like osteoarthritis. It is better to control joint pain,
Mm-hmm.
and because they will walk better.
Mm-hmm.
And people who have the osteoarthritis tends to fall more,
Mm-hmm.
and also have people who have the tremor,
Mm-hmm.
like a Parkinson's.
Mm-hmm.
They are at risk for fall. They are also at risk for low blood pressure when they stand up.
Mm-hmm.
So they has to be taken care of with caution when we give the blood pressure medicine. Check the blood pressure good, and they'll tell them check your blood pressure at home if necessary. And any blood pressure medicine needs to be monitored closely.
Mm-hmm.
You don't have. They should go to the doctor more often than other people,
Mm-hmm.
not once a year.
Mm-hmm.
And weakness from any cause
Mm-hmm.
at risk for fall.
Yeah, yeah. So those are, I think, very valid points about medication. One thing I see all the time is a lot of doctors keep adding medication. They don't reconcile medication and really look at whether that patient really needs that medication or not. And we are, if we thrash through those, and especially these anticholinergic, one medication I see which is a big problem is Benadryl. So they tend to
That's right.
give Tylenol PM or so I said no, that's absolutely antihistamine, anticholinergic. For people to understand, those medications tend to dry you and remain for their half-life, which is the duration your body needs to get rid of the medication has to be 3 times their half-life, so it is lasts more than 24 hours in somebody's system. So that really is very difficult for elderly. And like doctor mentioned, make sure that go through the medication list. So for family to understand, the medication list has to be accurate. So if somebody added a medication, make sure discuss with your provider whether that is really needed or not. Okay, because and certain medications, especially those will cause low sugars, are very dangerous because they can pass out and nobody would know. And that usually happens if they are by themselves. It can happen they can be on the floor for many hours. So other thing we like to discuss from you, what things at home they can do to help or make sure those risks are addressed.
Yes, some of the risk can be managed, and there's a lot of like a home safety list of things that you can do. Well, like one thing we always say that to make sure that you have a carpet, not the wooden floor, which is can be slippery and you fall. And the another thing is avoiding throw rug at all cost, or having a especially you can trip on this the throw rugs because you do not raise your legs or feet as much as and younger people will do. So when you are walking and not lifting your leg, even a little bit of raise of a rug will be enough to throw you forward. And there should be no clutter in the floor or no low level furniture where you can hit your legs and fall. And there should be rails whenever that's necessary because that will help you to avoid a fall. And also light. Light is very important because if you have an issue with a sensation in your feet, you'll compensate with your eyes. And so that if you have a handle to grab on and the light to see, you may be able to avoid one fall at least. And for bathrooms, there's a lot of fall in the bathroom. For many reasons, you may have a vasovagal issues like your blood pressure drops and the pulse drops and from the straining. And a lot of people you see fall at home. It's a slippery, water, so all kind of thing that makes it difficult to walk. For them, grab bar is essential. You throw a rubber mat on the floor so that you don't slip. And you help with to get out of the commode, you have to have a raised toilet seat, and which is very inexpensive and can be used on any toilet. And that helped a lot of people to get off that toilet with ease, especially if you have a grab handle. And it's also useful in somebody who has a lot of joint pain because they cannot go down and get up that easily. Those are things that can be done at home to make life a little easier.
So also tell us a little bit about those devices which sometimes they put to bed alarms or some kind of so they don't wake up in the middle of night and go to the bathroom, because like you said, a lot of falls will happen in at night maybe, or lack of vision. And and the other thing is the bed. I think the bed has to be modified in the height so they don't fall while getting down from the bed. And second is so tell us a little bit what they could do. Should they put alarm, or should they have some other devices you can suggest?
Alarm sometimes almost looked at as a restraint. And sometimes they can startle them. And people who are confused may not even hear these things if you have hearing problems. Nurse may be far away, further enough that people will get out of the bed and fall. So, in a nursing home, 1/3 of the patient probably will fall every year. And so it is in spite of all the things. And as you know, you're not allowed to use guardrail on the side because they found that this has caused a lot of falls for higher height and more injuries. Neither you are allowed to keep restraint. And because restraining a confused patient is very difficult, and that makes them more confused and agitation. So they will not sleep. So, this is a double whammy that way. And what to do is always been a issue, what to do. But we use bed alarm. We put a blue light in the room just to see whether they sleep better.
Oh.
So, but these are not very, very effective, and but the best we can try. But when you see a person who is already walking, how would you figure this out, that whether he's at risk or she's at risk? So we do a few tests for that. So one is that you tell them to stand with one leg and see how long they can. If they not able to stand, then you know that he or she is high risk for fall. And we also call a test to walk 10 feet in 30 seconds. They call up and go.
Up and go.
And that is a good test. If you take more than 10 seconds, you are at risk for fall.
Wow.
Then you tell them to get some exercise, physical therapy, everything possible to get stronger. If you make it less than 10 seconds, then you are good. It's less likely to fall. So there's some measures we can do to prevent and help them before this happens.
Okay. So for our audience, I would just kind of summarize a little bit. So make sure, realize the risk factors. So for fall, most would unfortunately happen at home. And so we want to make sure the environment is protected, make sure the bed is lower level, make sure there's adequate light. And if they did not have vision check, make sure get those checked, because those fall will happen unfortunately because they can't see. So adequate light is very important. Going to bathroom, that is, they should call or do something, but not to attempt in the middle of night and fall. Remember, the fall can cause a lot of mortality even after the fracture is fixed, and that is very alarming. So the death rate, the complications are far more even if after the fracture is even healed and or pinned or whatever. So those are important things. Not to mention, you can have head injury, you can have other kind of injuries, and that can really complicate. Very important thing is look from the medication point of view, discuss with your provider and ask basic question whether somebody really needs that medication. Okay, is there a simpler way? And look at the interactions are also important. Those medication which gonna last 24 hours, like Benadryl, very notorious. So make sure don't give them Benadryl. It is not a benign medication, and it is one of really highly controversial in my opinion. But discuss and make sure if they really need it. Don't give them medication to sleep because that really impairs their reflexes. So some of those anxiety medication, those benzodiazepines, are worse. So it's very important to realize for fall, their reflexes and strength are very important. So you can check on the risk factors like doctor mentioned about certain 2 tests you can do is to make sure they can up and go from the chair, and also if they can do some therapy, maybe strengthening their muscles a little bit, reflexes, and those are important. In case they fall, at least they can correct themselves. So those are important. Some movement, and those are very important. Not to mention osteoporosis risk. If somebody is in bed for too long, their bones will get weaker, and if they fall, they're going to break. So those are very important concept. So nutrition is also important. Make sure they have adequate protein, because muscle wasting will happen, and that is one of the important things when we discuss, is that adult malnutrition, especially to protein, is very very high. And so you have to be because their appetite is low, and they're not going to eat much, and that makes it very difficult so to feed them actually, and also take care of them. So but if we are well educated, and we look for these risk factors and take the time to discuss with your providers, sometimes it's better if you also have the idea of same thinking which we want for our loved ones and patients and everybody. Then it makes it much easier to manage a patient, because then we all are looking at one goal, and that is their safety. So with those some words, I'll also ask for final words from Dr. Ahmed, and then we'll wrap it up. Dr. Ahmed, any more additions you want to add to that?
Yes, I think if you want to treat them, what would you do?
That's true.
That is, you can tell them to do some exercise. One exercise has been proven that is good, is Tai Chi. It's been practiced for probably 1,000 years, and that gives you good balance. And people who have the good balance don't tend to fall. And there is a lot of data to prove that they are effective. And as Dr. Moby already suggested, that probably avoiding medicine that is not good for you will be a good start. And daily exercise is very important, even in older people.